According to the American Society of Plastic Surgeons, the number of minimally invasive cosmetic procedures have increased now nearly 200% since the year 2000. One international research company predicts that minimally invasive fat reduction procedures will be $1.1 million industry by 2022. This morning, Dr. Jack Shire from Charlotte Plastic Surgery is here to talk about some of those. My goodness, sounds like you're in the right business at least.
Yeah, it's become all the more popular. These days we have patients that can't handle the downtime of surgery or really don't want surgery in general. So these are new options we didn't have in the past, and patients are really taking advantage of them.
So these are all outpatient. You go in, you come out, you're able pretty much to get back to your normal life pretty quickly, right?
Yeah, sometimes the same day.
Oh my goodness. Okay, so let's start first with cool sculpting. We heard that term. I feel like we've even done segments on it before, but it's tough what is it exactly? What does it do for you and where on your body?
So cool sculpting is for fat reduction. It's for that fat that's just beneath the skin that sometimes is really hard to get rid of, no matter how hard you hit in the gym or how much you're dieting. There's these stubborn fat places that sometimes we can't get rid of it, even though we try our hardest. And what it does is it basically have an applicator that sort of sucks the skin and the fat in, and it freezes that fat. And when it's released, over the next month to 6 weeks, that fat gets resorbed by the body.
Is this for people who, for whatever reason, they gain weight in their hips or their arms or their tummy? That's just sort of where their fat collects?
It can be. Each person's different, so we individualize the treatment based on your anatomy and the way your fat sits on your body.
Okay, you were explaining Profound to me before, too, and can you do it again here for our audience at home? Because you'll do it a lot better than I will. When it comes to the skin tightening aspect also, because especially I would imagine for people who have gone through dramatic weight loss or had babies, you know, the skin tightening can be a real issue, too, because the skin still kind of stays stretched out. Yeah,
so what Profound is, it's the newest iteration of microneedling. What microneedling traditionally was is basically a series of needles that poke little channels in the skin, and when the skin heals, you get more deposition of collagen, hyaluronic acid, and elastin, which are the building blocks of skin. And what Profound is essentially it's radio frequency microneedling. So when you put those needles in, it heats up the skin. So when it heals, you get more deposition of all those things we talked about, and it actually tightens the skin and improves the texture.
The video that we're showing here is really showing all over the body, too, right? We just showed it on someone's face.
Yeah.
And then also on the backs of the legs. This is for anywhere?
So that was for cool sculpting. So that's the fat reduction. So these are some of the cool sculpting pictures you're seeing right here. And you can see those stubborn areas that can be in the lower belly or can be in the upper, lower back, or even other areas like, for instance, along the lateral thigh. That is all good candidates for cool sculpting, those areas.
Oh, what is that? What does she have done with the chin?
This is the Profound, like we were just speaking of. This is that non-invasive skin tightening. And that basically, you can see a 3-month result there. And that actually will get better even up to 6 months.
That was dramatic, too. That looked great. Okay, let's talk about injectables. Some of us are familiar with injectables already, more than others. For some of us, it's been a while since we've familiarized ourselves. Botox, a lot of people know of. Fillers, though, maybe not as familiar. Can you make the distinction between the two?
Yes, sure. So Botox is actually, we call it a neuromodulator, but to make it very simple, what it does is it actually weakens the muscles temporarily. So those lines in your forehead or around your eyes or between your eyebrows here, it softens them with time, whereas fillers are going to be to fill volume and fill wrinkles. So it's actually like you can think of a gel that you inject in somewhere.
And you're showing hands here. Because that's where they say people show their age first in their hands, right? Is it Botox or fillers that you do on a hand?
So we do fillers here, and that's absolutely correct what you say. And some people, you can really tell the signs of aging, those areas between your tendons and whatnot. Over time, you can see sort of little dips in those areas or contour regulators. So filler is perfect for filling those areas in and give you a much more youthful appearance to your hands.
I never would have thought of that, which is why you're here, Dr. Shire. Thank you so much for coming in. Appreciate the time.
Thanks for having me.
All right, you got it. Take a quick break, guys. We'll be back with more Good Day right after this.